Well, hello. Good afternoon. Mr Poots. I've come across a document that I think should be of enormous interest to you. It's the Home Affairs third report of 2002. And this is what it says on paragraph 9. At the outset, it is important to keep a sense of proportion. Legal drugs, such as tobacco and alcohol, are responsible for far greater damage, both to individual health and to the social fabric in general, than illegal ones. It should also be borne in mind that not all drugs are equally harmful. While the inquiry has not specifically considered the social problems caused by alcohol or tobacco, our work has proceeded with these considerations in mind. Paragraph 10. Substance misuse is a continuum, perhaps artificially divided into legal and illegal activity. Dr. Colin Brewer, addiction psychiatrist and medical director of the Stapleford Centre, was of the opinion that the big problem is that people are talking about drugs and alcohol as though they were somehow different. It's only in this century that the curious idea has grown up that it is all right to intoxicate yourself with some drugs, but not with others. Paragraph 12 is particularly shocking. In 1998, 27% of the population of adults aged 16 and over smoked cigarettes in England. And in 1995, over 120,000 deaths were caused by smoking in the UK. 20% of all deaths. The Royal College of Physicians has described cigarette smoking as the single largest avoidable cause of premature death and disability in Britain, and the greatest challenge and opportunity for all involved in improving the public health. Oh, fancy that. That's you, Mr Poots, yes. For the people in Northern Ireland. I put it to you that something has gone seriously wrong in our justice system since 2002. Because surely any judge, worth his salt, worth his pay packet, right, looking at paragraph 10 of the Home Affairs third report of 2002, reading that substance misuse is a continuum, right, okay, perhaps artificially divided between legal and illegal activity. Well, what's the justification for this artificial divide, Mr. Poots? I mean, when it comes to your pledge of office, discharge in good faith all the duties of office, commitment to non-violence, and exclusively peaceful means and democratic means. Right. C. To serve all the people of Northern Ireland equally, and to act in accordance with the general obligation on government to promote equality and prevent discrimination. So, how does that tally with the Home Affairs third report of 2002? This doesn't look good. CA. Still on the pledge of office, you understand. To promote the interests of the whole community represented in Northern Ireland Assembly towards the goal of a shared future. Yes, please. I'd like that. I'd like to be part of a shared future here. I would actually transform your care for me. That I be socially included rather than socially excluded. Because I happen to prefer using cannabis recreationally compared to tobacco or alcohol. See, I'm a closet Rastafarian.
Well, there's a legal one.
But it's true. Bob Marley's in my soul. Kaya. I want to have Kaya now, Mr Poots. It's been a long time since I've had that experience because of all these interventions that Pierce and I have been making. On your behalf, Mr Poots. As Minister of Health, you feel it's your opinion and it's not in the public interest that cultivation, possession, supply of cannabis be any way lawful at all. So you designated cannabis and the components of cannabis in Part 1 of Schedule 1 of the Misuse of Drugs Regulations. And designated cannabis as a drug to which subsection 7 brackets 4 of the Misuse of Drugs Act applies. But you can revoke that decision, Mr Poots. Subsection 7 brackets 5. Just like that. And redesignate cannabis as a drug to which subsection 7 brackets 3 applies. And immediately, on that being approved by the Northern Ireland Assembly, means people can go to their doctor, get a prescription. Just like that. So the question is, Mr Poots, and this is what we'd like to know, is how long would that take? Put it another way. How long could it take if you got all of it? You're like, tomorrow, this is what I've got to do, get on with this job. And if you made best possible haste, theoretically, hypothetically, given, the assembly was working as it should be, you wake up tomorrow morning, could you please tell me how long it would take for that bill to go through the assembly and for us to be able to go to our doctors and get our script? Because, and excuse me just for staying with your pledge of office just for one last wee moment here, you're meant to uphold the rule of law based as it is on the fundamental principles of fairness, impartiality and democratic accountability. All set out in paragraph 6 of the St Andrews Agreement. So, this accountability thing, so far, I've been given the account that you're delivering our care rather, in terms of drug misuse, rather on the basis of historical and cultural tradition. Well, funny enough, at this evening's meeting in Belfast, the Transform Your Care public meeting, Vision to Action, John Compton actually agreed with me when I put it to explain the situation I'd written to you, got a reply, and your reply said that you were making these decisions based on historical and cultural tradition. I put it to John Compton and I said, this is not acceptable. And he agreed. I see, he'd have to agree because it's actually in his report, Edwin. Page 18 of a review of health and social care in Northern Ireland, December 2011. Page 18. The fundamental changes to our population in terms of age and need are clear. We must design a model which acknowledges this and is based on the needs of this changing population rather than its historic configuration. So he was a bit stuck when I put it to him that historical and cultural tradition is not actually acceptable, accountable explanation for your decision making, Mr Poots. So, could you have a look at your pledge of office? Have a look at Section 7 of the Misuse of Drugs Act, particularly subsections 1 to 4 and 5, actually. Well, the whole of Section 7. Really please understand it. Section 22 is rather wonderful. If I can find it. Here we are. Further powers to make regulations vested in the DHSSPS, courtesy of the devolution of powers to the Northern Ireland Assembly. Well, thanks be to God. We have an accountable minister who has the power to exclude, in such cases as may be prescribed, the application of any provision of this Act, Misuse of Drugs Act 1971, which creates an offence. Well, yes, please. That's my vision, Edwin. And I'd like some action. Thank you very much. And good night.
Very good.